We have done a lot this summer, well, since March actually, working on how we create mitigation strategies. Working with the health department, Greene County Health, they've been fantastic, thank you. And just thinking through how do we do it, and it's been complex, but one thing we've done is that all of our students are in single occupant rooms on the campus. Only, some of them share a bathroom, but by and large not. Secondly, we have redesigned our classrooms so that we have 6-foot social distancing, of course, and we have a mandatory mask policy. We also have worked on egress and ingress and making sure that people in passing each other in the hallways and stuff are distanced. Now, our faculty also, we have a lot of cleaning protocols. In some cases, we have plexiglass in the classroom. A faculty member will be standing there with the plexiglass while they lecture or talk, because aspiration is one of the ways in which the community spread occurs. But really, what we've got to focus on in our community at large and on our campuses is this idea of personal responsibility and accountability, holding each other accountable, and knowing that in the middle of a pandemic, it's okay to say to somebody, you're not wearing a mask, would you please wear a mask? And it's okay for somebody to ask you that. Don't be offended. We are doing everything we can do in mitigation, and that we are asking them to help us with that. I think also I would say to them, in the midst of a pandemic, which we've experienced in, say, 1968 with the Hong Kong flu, people feel out of control, they feel vulnerable, they feel afraid for their loved ones. And in that context, people can, it could come out in anger and frustration with each other. So I'd say to my staff too, and the faculty and the students, let's operate on a principle of forgiveness and grace with each other. Number one, we are happy to have your student back, and we are welcoming them with open arms. And I'll say to those parents, I know some of you are happy your student is gone and coming back. And your students, they are wanting to have face-to-face interaction. That's one of the most important things for them. And so I would say to the parents, even if you have anxiety about them, we are doing everything we can. On the Panther Plan, on Drury's Panther Plan, there's a phone number and an email if you have concerns about a specific issue, or if you just want to talk, please use that. Also, please stress to your student the importance of this, because it's not just about them, which is hard for some people at that age to absorb, but it's about others. And so it's other regardingness, that's very important to emphasize. The entire country is struggling with this issue right now. Big time NCAA football, and for the fall, we all love that. We want it to be back, but we want our students to be safe. They're students first and athletes second. So what we're doing is we're working with the NCAA, who released on Wednesday some very stringent protocols. And we're trying to figure out how we will meet those. It's not just competition that is the issue. It's practice. And if you cancel the seasons or move them to the spring, you still have the issue of practice, because these student athletes want to practice, and they're elite athletes, and they're very competitive. And so how do you make it possible for them to have that experience? So we're looking at sports that are not very complicated, say tennis or bowling. And you're looking at sports that are more complicated, baseball, for instance, or softball. Then you're looking at sports like football, soccer, volleyball, that are very high risk because of the nature of their contact with each other. So I think the question is out on practice and on competition, and it's still not resolved. I will say that we have to accept the idea that we are going to have outbreaks. We have to accept the idea that people are going to get sick. But we have to say, how do we work our dead level best to prevent that? And if we do have an outbreak, how do we work on campus in the contact tracing? Greene County Health's been fantastic in helping train our people to do contact tracing. and we've got a crew of folks. We have people that will be delivering meals to students who will be quarantining, because all of our students will have single rooms and they can quarantine in place. So we have plans for that, but I tell you, it's dynamic, and we're looking to our health professionals to work closely with them, and we're doing wonderful work between the universities. We meet regularly and talk. So I think, it's going to be okay. We're saying to our students and our faculty and staff that we have mandatory mask and distancing and hygiene. But when you go out into the community of Springfield, you're responsible too for other regardingness. That if you go downtown or you go out to one of the pubs or bars, you have to think about, are you going to still take care of others around you and your family and have a regard for the other people in the community? It's an opportunity for us to think about, what does it mean to be a citizen, and what is my civic responsibility, and what is my responsibility toward others? So we're trying to drive that message home. In terms of higher ed, this is the biggest crisis in higher education probably since the Great Depression, or even the pandemic of 1919 and the First World War. Higher education got through that. Drury got through it. Other institutions in the city got through it, but it is not without pain. There are huge financial ramifications. Higher ed is losing revenue at a tremendous rate, on average about 15 to 20%, which means a contraction of the organization by about that amount. It also means stepping up fundraising and relying on those who love these institutions here in our community to say, you know what, my business has boomed during this COVID crisis. So you know what, I want to give philanthropically to our institutions in this city to help them to lean on these businesses that have done fantastic in this COVID crisis, to say that's our part in this community. So I would encourage anybody who has benefited in their positioning in the market as a business or organization to help others, as we are doing with masking. Number one, it's okay not to be okay. But number two, we are called to reflect in an educational process about what does it mean to be a human being. What is the human condition? And the human condition in this kind of pandemic is clearly transparent. And it's a condition in which we're vulnerable and we really have no control over our lives when we get in a car or when we get on an airplane or whatever. We are vulnerable. And so I would say to students, show care and love toward others, and think about others and what they're feeling inside, and you don't know what they're feeling inside.